Hi, I'm Dr. Rick Van Etten. I'm the director of the Chao Family Comprehensive Cancer Center here at UCI and UCI Health. Welcome to the Cancer Center building. We're one of 51 NCI designated comprehensive cancer centers in the United States and the only one here in Orange County. We have a mission to conduct research in cancer across basic, translational, and clinical research. This building here behind me is where we do most of the clinical care and the clinical trials research that we do. Right next door is the Chao Digestive Diseases Center, where we collaborate with a lot of gastroenterologists to take care of people with gastrointestinal cancer. Right now, I'd like you to come inside the lobby to see how we engage our patients. So this is our lobby and our registration area where patients get ready for their appointment. You can see that our waiting area is very modern, looks a little bit like a hotel lobby. On the first floor here is our radiation oncology department where people get radiation therapy. And then on the upstairs floors, we have the Infusion Center and the actual clinic space. So why don't we go take a look at radiation oncology right now. So welcome to the radiation therapy suite in the Cancer Center building. This is where patients come in and get registered. Patients get a lot of their treatments here, and they're also an active participant in clinical trials at this site through Radiation Therapy Oncology Group and others. So what we're going to see down this hallway here, we're going to see one of our linear accelerators, the Varian TrueBeam, and also a CT treatment planning area and a dosimetry site. So why don't you follow me? So we have two linear accelerators here in the radiation oncology suite. This is just the control room for the Varian TrueBeam, where they're doing treatment planning for a patient right under the beam today. So this is the CT simulation room where treatment planning takes place. Patients have a CT scan in order to precisely gauge their therapy. It can be a little intimidating in here, so to overcome that, we try to have a virtual environment for the patients. Right now we have the Mojave Desert, but if we want, we can go to the Caribbean and watch dolphins. Next, we're going to walk next door and actually see a dosimetry session where the treatment dose is planned for a patient. So this is the dosimetry room where the medical physics folks use computer programs to actually plan the treatment dose to maximize the dose of radiation to the tumor and minimize the radiation to the surrounding normal tissues. Next, we're going to go upstairs to the clinics and the Infusion Center. So this is our Infusion Center and clinic. We see about 60,000 patient visits a year here, including about 3,500 new patients every year. We're going to go into the Infusion Center next. So this is our Infusion Center where patients get chemotherapy and blood products. Also, many clinical trials are carried out here. We have about 40 infusion stations for patients. We're currently open 6 days a week, and we're about to open 7 days a week on Sunday. This is the pharmacy here, which includes both FDA-approved drugs and also our investigational pharmacy, where we have experimental agents that we use in clinical trials. Next, we're going to walk around the corner and head toward our clinic itself. So this is our clinic where we actually see our patients. We have a registration desk here staffed by our nurse navigators who are essential to our mission. We also work here with residents and fellows, and we accrue a lot of patients to clinical trials here in this space.